Good morning. My name is Datsine Elio, a level 1 BSN student. So today I'm going to perform the return demonstration on comprehensive physical assessment. So what is the meaning of the comprehensive assessment? So it is completed in such instances when the client's first visit to the healthcare provider to obtain an overall impression and also the baseline data. So when we are using a head-to-toe approach, some body system may be assessed in combination. So for the purpose, there are three purposes that we have in the comprehensive physical assessment. First, this is to obtain an overall impression of the client's health status. It also being for the baseline data. And lastly, it is to utilize for the focus assessment technique to the patient that has a potential problems. And we are on the special consideration. For the special consideration, it is very wise to break up the assessment into parts to allow both of you and also our patient to have a rest periods. So it is also more than it is more than one correct way to integrate for the entire health history and also the physical examination. However, it is more important to develop a consistent and also the logical routine to avoid for omitting of the significant data collection from your assessment. So also, some population or groups may have an assessment results that that is normal, but it will be a deviation for the some usual findings. So the nurse must be aware of those deviations. So now we are on the equipments. So first that we have is the clean gloves. We have 2 pairs of the clean gloves. We also have a mirror, a stethoscope. We also have a substances for smelling and also for tasting. For smelling, we have a coffee. We also have calamansi. And then for tasting, we have a salt and then we have we also have a sugar. And then we also have a paper clip. We also have a skin marking or ballpoint pen, a cotton buds, and then we're also having a cotton balls. We also have ruler for centimeter markings. We also have a small cup for our for drinking. We also have a metric tape, a jot down notebook, a tongue depressor. We also have a pen light, and then we also have a newspaper and a kidney basin with a paper lining, and we have a gloves, and we have also a watch on the watch, and we also have a plate. So these are the materials that we are need on the procedure. So after that, what we're going to do is we're going to prepare for the necessary equipment and also the supplies. So we have prepared it and we're going to put it into the bedside. So we are in the on the patient, and then so this will reduce the transmission. It also spreads reduce the spread of the microorganisms. And then what we're going to do is we're going to perform hand hygiene. So in hand hygiene, this will save time and also effort, and it will reflect for the patient's effort for preparedness for the preparation. We're going to introduce ourselves, and then we're going to verify for the correct patient or the we're going to verify for the patients identity, and then we're going, so it will alleviate the anxiety of the patient, and also it will ensures that the correct procedure is given to the right patient. So, good morning, ma'am. My name is Destiny Elio, a level 1 BSN student. So, I am a nursing student in NDMU. And may I know your name, please?
Marshane Payton.
Okay. Can I call you Ma'am Marshane? Is it okay? Okay. So after that, we're going to explain the procedure to the patient. So in explaining the procedure to the patient, it will alleviate the anxiety of our client. So ma'am, so today I'm going to mag-perform ako ng comprehensive physical assessment, which is from head papunta sa toe niyo po. Medyo hindi siya madali, pero i-ensure ko po, gagawin ko po yung makaya ko para mapadali siya. Okay lang po ba, ma'am?
Okay.
Okay, thank you po, ma'am. So after that, we have explained the procedure to the patient. We're going to provide for the client's privacy. In providing the client's privacy, it will ensure that the client is in relaxed state. It will minimize for the false result of the results, and then in this false result, it will due to the discomfort of the patient, and also we're going to maintain for the patient's dignity. And then what we're going to do is we're going to apply clean gloves. This is to protect the patient and also the nurse from the cross-contamination. Now that I have done the clean gloves, we're going to observe for the appearance of the patient. So it will give an overall impression to our patient. So just by looking at your patient, you can see the overall appearance of the patient. So I can see that the patient is at good condition, and it is the patient is you can see by the patient's face that she is doing. So after that, we are going to assess for the skin. So in assessing for the skin, we're going to assess for the skin for the color variation, for the texture, for the temperature, for the turgor, also for the lesions, and then for the edema. So the normal finding of the patient will be, we're going to have a uniform skin color with a slightly darker exposure of the skin, and then the temperature may varies to the area that you have been assessed, and the turgor also is the tool that you have assessed for the hydration status, but you can't assess it for the elderly people. So ma'am, i-check ko lang po yung skin niyo po. Okay, ipataas ko lang po yung sleeves niyo po, ma'am, ha? Okay po. I-assess ko lang rin po yung turgor. Ganyan lang po, ma'am. Okay na po, ma'am. So, as we can see, the patient skin is normal since it has a darker exposed or dark exposed areas, and also the turgor, and the patient's temperature is warm. So after that, the thing that we're going to do is we're going to teach the patient to have a self-skin examination. So this will promotes the patient independence and will allow the patient to have or to detect for the changes of her skin. So ma'am, turuan ko po kayo kung paano po tayo mag-assess ng ating skin para makita mo po yung mga changes sa iyong skin. So ganito lang po yung pag-check or pag-examine. So pag dito po sa harapan, okay lang po na hindi tayo magamit ng mirror kasi makita mo naman siya. Pero pag sa likod po, gamitin mo to, ganyan lang po para makita mo po yung changes sa skin mo. Tapos sa isang side naman, ganyan mo naman. So gusto ko makita kung paano mo i-perform yung paggamit ng mirror. Yan, ganyan po ma'am. Sa piyak ng, sa kabila na. Okay po ma'am. So, after that we have done teaching the patient, we are now going to the head and also the face. After we have done on the skin, in the skin, we're going to the head and the face. First thing that we're going to do is we're going to inspect and palpate the head. So we're going to note for the consistency, the distribution, and also the hair or the hair color. So the gender, the age, and also the genetics will affect for the distribution of the hair, and then the hair should be evenly distributed. So there are exemptions for the balding. There are exemptions for the male, and also for the elderly people, and the hair is thin for those with age. So ma'am, i-inspect ko lang po yung hair nyo, and then ipalpate ko po siya ma'am. Okay, as I can see, and as I inspect and palpate it, the hair of the patient is consistent, and also it is equal distribution, and the color of the hair is normal. So after that, we're going to observe for the symmetry or the face. Observe the face of the patient in the symmetry, the features, and also the expression condition of the skin. So the facial appearance will varies at the age, the gender, and also the race or the ethnic group of the patient. However, there should be symmetrical of features and also in movement. So ma'am, pwede ko po pakitanggal po yung face mask natin po. Ay, parang ganun po. So ma'am, tingin lang po sa akin. So, as we can see, as we observe for the patient's face is symmetry, and also the condition of the skin is good. Now, we are going to have the client smile. We're going to have the client frown. We also have the client show the teeth, and the blow out the cheeks, and also we're going to have the client raise her eyebrows. And we're going to tightly close the client's eyes. So normally the client can follow all the extraction of the nurse, and then the client can close the eyes of the patient against the resistance. So all movements should be symmetric, and inability to close the eyes of the patient, and also the wrinkle of the forehead or raise of the forehead with the paralysis. The paralysis of the lower part of the face with the affected side is seen with the Bell's palsy, which is a peripheral injury to the cranial nerve 7, which is the facial. So ma'am, pwede ka po mag-smile tayo ma'am. And then ma'am, mag-frown ma'am, mag-sad face. Tapos mag-blow out ng cheeks ma'am, ganyan ma'am. Tapos ma'am, paki-raise ng eyebrows natin ma'am. Tapos ma'am, paki-close ng eyes niyo ma'am. Tapos nang batuan mo siya ma'am. Sige ma'am. Close ng eyes mo ma'am. Tapos nang tightly close gid ang eyes. Kusugigin nga pag-close. Okay. So as we can see, the clients can apply all the nurses, the instruction of the nurse, and it is also symmetric, and all the movements are symmetric. So after that, we are going to do the test, the sensation of the forehead, also the cheeks, and also the chins. So we're going to instruct the patient to say now if the patient feels the sensation of the face. So first, we're going to use a cotton wisp to touch or to have a light touch, and then after we're going to use the sharp part of the paper clip to use for the for the sharp sensation. Then we're going to apply it with the patient's jaw, the patient's cheek, and also the patient's forehead. So we're going to compare it bilaterally. So normally the patient can perceive the touch that we the sensation, and then if the patient is not able to feel the correct identity of the sensation, it will occur with the lesion of the trigeminal nerves. So we're going to ma'am, mag-assess po ako ng light touch. So, ito po yung gamitin natin, yung cotton balls. So, pag ma-feel mo po to, magsasabi lang po kayo ng now. If ma-feel mo po to, sabi lang po kayo ng now. So, kindly close your eyes, ma'am. Tapos, pag ma-feel nyo po, sabi lang kayo ng now.
Now. Now. Now. Now.
Okay po, ma'am. And then, ma'am, gamit po tayo ngayon ng sharp, pero hindi naman siya masyadong masakit, pero pag ma-feel mo siya, ganito po yung, okay po, ma'am? Kindly close your eyes, ma'am. Close your eyes. Sige.
Now. Now. Now.
Okay na po. So, as we can see, the patient completely, feel the sensation. So, it is normal. And then, after that, we're going to palpate for the temporal arteries for the elasticity and also for the tenderness. So, the patient's temporal artery should be elastic and also it should be non-tender. So, ma'am, ipalpate ko po ngayon ang temporal arteries niyo po. Hindi po siya masakit, pero pag may ma-feel po kayo na masakit, sabihin niyo lang po, ma'am. Okay po, ma'am? Sige, ma'am. Sige, ma'am. Masakit po ba, ma'am?
Hindi.
Ito, ma'am.
Hindi.
Ito, ma'am.
Hindi. Hindi.
Okay. So, as we can see, the patient's temporal arteries is elastic and also it is non-tender, since the client say that it is non-tender. So after that, we're going to palpate for the temporomandibular joint. So normally, the jaw should have the full range of motion, and then the temporal and also the masseter will contract bilaterally. So an asymmetric strength in moving of the jaw will be seen with the lesion or the injury in the fifth cranial nerve of the patient. So, ma'am, ngayon po, ano ko lang po yung test ko lang po yung temporomandibular joint niyo po. Tapos, magsabi lang po kayo if masakit siya o hindi. So, ito ma'am, masakit po ba, ma'am?
Hindi.
Ito ma'am.
Hindi.
Sige daw ma'am, i-open niyo po yung ano niyo, tapos i-close. Sige ba? Masakit po ba, ma'am?
Hindi.
Sige pa, ma'am. Hindi. Masakit, ma'am?
Hindi.
Okay. Thank you, ma'am. So, after that we have done, we are now in the eyes. So, in the eyes, first that we're going to do is we're going to assess for the visual function using the newsprint. So, we're going to have the patient hold the newsprint for 14 inches from the patient and have the patient read it. So, the adults can read the newsprint easily at the distance of 14 inches, and it is recorded as 1414 OS OD OE. So, ma'am, ngayon ma'am, gagamit po tayo ng newspaper po ma'am, at saka so, 14 inches from your, away from your eye, tapos basahin niyo lang po kung anong dapat niyo basahin. Ay, kung anong makikita niyo po dito. So, first, ma'am, i-assess po natin yung right eye niyo. So, i-cover niyo po yung left eye. Sige, basahin niyo po, ma'am.
Cases of COVID-4 2019.
Okay na po, ma'am. Sa kabila naman po, ma'am, sa left eye na po tayo.
There are over 1 million people that are affected with this case.
Okay po, ma'am. And then, paki-read na lang po ng both eye niyo po.
Many people are being affected.
So now we are done with the visual function. So as you can see that the patient is easily can read, and it is recorded as 14/14. Since the patient can read both his left and also his her right eye, and also the both eyes. So after that, we are going to inspect for the external eye. So we're going to note for the client, and also note for the client's clarity, and also the parallel alignment. So the eye should be clear, and also it should be bright. And we're going to note for the presence of the contact lens, and there is no casting, or also the infestation over the eyelashes of the patient. And the normal finding is there is no lesions or edema on the eyelids of the patient. So ma'am, straight lang po dito sa akin. Mag-watch ka po sa akin. Okay po. So, as we can see that the patient eyes is clear, and also it brights, and it is in the parallel alignment. So there is no contact lens, and there is no casting, and also there is no edema and lesions on the patient's eyelids. So after that, we are going to test for the papillary reaction to light, and also for the test of the accommodation of the pupils. So first, we're going to the test for the papillary reaction to light. So we're going to note for the pupil size and equality, and then the thing that we're going to do is for the papillary reaction to light. So we're going to test it, and then we're going to have the patient look to the straight ahead, and then we're going to bring the light from the side over the eyes of the patient. And then we're going to note for the reaction of the patient to light, and also the speed of the both eye. And then the pupil should be equally round, and it also will be reactive to the light, and also the accommodation. So first, we're going to assess for the test papillary reaction to light. So ma'am, ang gagawin ko po ngayon is i-test ko lang po yung reaction to light niyo po. Straight lang po kayo doon sa tapos i-assess ko lang po siya. Straight lang po kayo. So, as we can see, there is the pupil size is equal with the other side. So, and then we're going to test for the accommodation of the pupils. So, ma'am, I want you to mag-focus lang po kayo dito. Tapos, mag-ano lang po kayo sa pinaka Okay po, ma'am. So, the patient is eyes is normal, and also this it is equal, and it is equal. So now we are going to assess for the cranial reflex on the cranial nerve number 7, which is on the facial, under the facial. So first thing that we're going to do is we're going to shine the light directly on the patient's eye, and then we're going to note for the position of the light reflection of the cornea, and also on each eye. So the light, it should be seen symmetrical on each cornea, and then if it is asymmetrical, we're going to suspect it as a extra ocular muscles, or it is the strabismus. So ma'am, look at your far side again, ma'am. As we can see, it is normal. As I assessed it, it is normal since it is symmetrical on each cornea. So, after that, what we're going to do is we're going to the ears. In the ears, the thing that we're going to do is we're going to inspect for the auricle, the tragus, and also the lobule. So we're going to it should be same as the facial skin. It should be same color, and then we're going to inspect for the position. We're going to note for the level at which the support aspect of the auricle attaches to the head that is related to the has relation to the eyes, and then the auricle should be aligned with the outer canthus, and then above it is about 10 degrees from the vertical. So ma'am, dito ka lang po sa akin. Sige. So that when I inspected it, the patient's it is in the level, and also it is symmetrical, and it is aligned with the outer canthus. So now we are going to palpate with the auricle and also the mastoid process. So first, we're going to gently pull the auricle upward, downward, and also the backward. So the auricle should be firm. It also should be mobile and non-tender. And if we folded it, it will be recoiled. So ma'am, assess ko po lang, ano ko lang po yung ears mo, pataas, pababa, at saka sa back. So magsabi ka lang po ma'am if may nararamdaman ka pong sakit, wag po kayo magsabi. So, ito po ma'am, masakit po ba? Ito ma'am.
Hindi.
Ito po ma'am, sakit po ba?
Hindi.
Okay. So, the patient has normally ears, and when we are going to fold it, it should be recorded. So, ma'am, i-fold ko po siya ha. Ito ma'am, sakit po ba?
Hindi.
Ito ma'am. So, the patient's ear can be recorded. So, after that, we are going to the test hearing. We're going to perform the watch tick test. So, in the watch tick test, we're going to have the client cover the opposite ear that is being tested, and then we're going to hold the ticking watch within 5 inches away from the patient, from our patient, and then we're going to note for the ability of the patient's hearing. So the patient should hear the tick of the watch from the distance of 5 inches. So ma'am, first natin i-assess is yung right ear mo po. So you cover your left ear. Tapos ma'am, if may marinig po kayo, sabihin lang po. Hindi, dito po, ito sabihin. Sige po ma'am. May marinig po ba kayo ma'am?
Oo.
Okay. Sa kabila lang po ma'am. May marinig po ba kayo ma'am?
Oo.
Okay. So once that I have done the watch tick test, now we are going to do the test of hearing, which is the whisper test. In whisper test, we're going to have the patient cover the opposite ear being tested, and then we're going to stand 1 to 2 feet behind the patient. So, and then we're going to whisper to the patient, and then we're going to note for the ability of the patient to hear the sound. So, the patient must repeat the words that we have said to the patient, or we have whispered at the distance of 1 to 2 feet. So, ma'am, kindly stand, ma'am. Sige, ma'am. Tali ko naman, ma'am. So, ma'am, i-cover niyo po yung left ear niyo po, kasi assess po natin yung right ear. Okay. pag may marinig po kayo, ma'am, sabi ko ano ang sinabi ko, kasi i-whisper ko lang siya, ma'am. Kung ano sasabihin ko, sabihin niyo, ma'am. Okay po, ma'am?
Okay.
Dog.
Dog.
Cat.
Cat.
Okay, ma'am. Sa kabila naman po, ma'am. I-assess naman na natin yung left ear niyo po, ma'am. Elephant.
Elephant.
Crocodile.
Crocodile.
Okay na po, ma'am. So, sige, ma'am. So now that we have do the test hearing, so it is normal since the patient have heard what we whisper to the patient at a distance of 1 to 2 feet. So now we are on the nose and also the sinuses. So in the nose and the sinuses, we're going to inspect for the external nose. So we're going to inspect for the external nose. Sige ma'am, tingin ka lang po sa akin ma'am. Now that we have done inspecting the external nose, we're going to palpate the external nose for the tenderness. So we're going to note for the shape, the size, the symmetry, the midline placement, and also the shape should be symmetrical and also consistent. So, it will consistent with the age, the gender, and also the race or the ethnic group. So, there is no nasal flaring and also there is no drainage. So, ma'am, ipapate ko lang po yung nose niyo po. Tapos, if may ma-feel po kayo na masakit, sabihin niyo lang po sa akin. Sige. Ma'am, ito po, masakit po ba, ma'am?
Hindi.
Ito po, ma'am.
Hindi.
Ito po, ma'am.
Hindi.
Ito po, ma'am.
Hindi.
Okay. Thank you po, ma'am. Now that we have done it, what we're going to do is we're going to check for the patient's airflow through the nostrils. So the thing that the cartilaginous portion should be slightly mobile. It should be non-tender, no muscles, and also the nerves in the patient. So, ma'am, assess ko po yung nostril nyo, i-cover ko po yung isang nostrils, and then, itry ko po feel if normal po yung breathing. Sige, ma'am, assess ko po muna yung right nose. Sige. Sige, ma'am. Okay, so, as you can see, I can feel the air, the breathing of the patient. Sa left naman po, ma'am. So, it is equal since the patient's both nasal, both of the nasal, the nostrils rather, is normal and it is non-tender. After that, we're going to include each nostrils, and then we're going to ask the client to smell the soap, the vanilla, or also the coffee according to the cranial nerve number 1. So, normally, the client should distinguish the different aroma to each nostril. So, ma'am, ngayon po, ma'am, i-distinguish niyo po, ma'am, kung anong aroma yung pinasmell ko po sa inyo by closing your eyes. So, dapat i-close niyo ang eyes niyo, tapos i-test ko po yung each nostril niyo para malaman niyo kung anong aroma po yung pinasmell ko sa inyo. So, ma'am, kindly close your eyes, ma'am. Sige, ma'am, close your eyes. Sige, ma'am. Assess muna natin yung right. Ano po to?
Coffee.
Okay po, ma'am. So, close your eyes lang po, ma'am, ha? Sa left naman po tayo. Ito po, ma'am.
Calamansi.
Okay. Now that we have done it, we are now going to transilluminate for the frontal sinuses. So, we're going to transilluminate for the frontal sinuses by we're going to shining the light on the upward of the patients under the eyebrow, and so normally it should be red glow and also that has noted above on the patient's eyebrow. And then also we're going to transilluminate for the maxillary sinuses by shining the light also, and normally there should a red glow also that is noted for the roof of the mouth. And below the eyes, when we are looking for the red glow on the roof, palate, and of the mouth. So, ma'am, assess ko lang po yung ano nyo, ma'am. Hindi po ito masakit, ma'am. Ano ko lang po sa eyebrow nyo po. Pero if may na-feel po kayo na masakit, sabihin nyo lang sa akin, ma'am ha? Okay po, ma'am. Okay, ma'am, close your eyes, ma'am. Masakit po ba, ma'am?
Hindi.
Ito, ma'am.
Hindi.
Kabila naman po, ma'am. Masakit po ba, ma'am?
Hindi.
Ito po, ma'am.
Hindi.
So, as we can see, it is normal since the patient has, it is said that it is not tender, and also there is a red glow on the patient that we have noted on the patient's below the eyebrows. So after that, we are now on the mouth and throat. So in the mouth and throat, first thing that we're going to do is we're going to change our gloves. Then we're going to change another gloves. Now that we have done the gloves, we're going to inspect for the patient's lips and also the teeth of the patient. So, it should be midline, it should be symmetrical, it should be pink, moist, and also it should be skin intact. So the coloring consistent with the ethnic group or on the race. There is no usual odors, and the teeth should be white or else pale yellow, and then the patient's teeth should be not loose with a good occlusion and also a good repair. So ma'am, kindly look at me, ma'am. Kindly smile, ma'am. Okay, ma'am. So I can see the patient as lips is symmetrical and it also intact, and then it is pink, and as I can see is the patient has a moist lip, and then it also the patient's teeth is normal since it is on the pale yellow color, and it is not loose, and it is in a good repair. So after that, we're going to check for the gums of the patient and also the buccal mucosa. So it should be pink, it should be moist, and also it should be intact, and the color will acceptable if the consistent on the patient's ethnic group or the race. For the instance, if the patient has a dark steeping dark skin patient. So ma'am, kindly open your mouth, ma'am. Sige ma'am, sige pa ma'am, apa po ma'am, apa po. Sige pa po, apa. Okay. So, for the patient's gum, it is pink, it also moist, and the patient gums is it also intact. The patient's mucosa and is intact. So after that, we're going to inspect for the hard and also the soft palate. So the palate should be intact, it should be smooth, it should be pink, it should be bony, and the mucosa covered with the projection on the hard palate and on the floor of the mouth, which is normal variations. So we're going to inspect. Sige ma'am, sige ay pag sige pa ma'am. So okay na po ma'am. So if you can see it directly, you can use a tongue depressor. So as I can see, the patient's hard and soft palate is normal since it is intact and also smooth, and in the hard palate it is bony. So after that, we are going to observe for the uvula. In observing for the uvula, we're going to have the patient say ah in a prolonged manner. And we're going to note for the symmetrical rise of the uvula. So it should be midline, it should be pink, moist, and there is no lesion that we have find in a normal, and it also is symmetrical rise of the uvula under the cranial nerve number 7 and also the cranial nerve number 10. So, ma'am, kindly say for prolong, ma'am. Medyo matagal. Sige pa, ma'am. Po, ma'am. If we can see it directly, we can use a light. So, moms, kindly say po. Okay po. So, as I can see, the patient's uvula is in the midline. It also pink and it also moist, and it is normal since it doesn't have any lesions, and it is symmetrical. So, after that we have done for observing the uvula of the patient, we're going to assess for the gag reflex in the cranial nerve number 10. So we're going to test for the gag reflex. We're going to touch for the posterior nasopharynx posterior pharynx of the patient by using a tongue depressor. So normally the gag reflex should be intact, and other clients that is normal may have a reduced and also the absent of the gag reflex, and absent of gag reflex may be seen with the lesions on the cranial nerve number 9 or number 10. So ma'am, itong procedure na to, medyo maditiwal po kayo, pero gagawin ko po yung para mapadali po siya. Pero hindi po talaga kayo komportable dito, pero madali lang po to. Operate lang po kayo. Sige ma'am, alam po tayo ma'am. Check po yung gag reflex. Sige, apa po. Sige pa po. Okay. So, it is the patient gag reflex is intact, and it also normal. So after that, we're going to inspect for the nostrils. So it should be symmetrical, pink, clean, and also clean crypts, and the crypts may be in the variation which is the normal, which the small food particles, and we're going to scan for the amounts of the white cellular debris. So after that, we're going to inspect for the tongue. Inspecting the tongue, it should be moist, it should be pink. So the coloring may vary, it depends on the ethnic group, if the patient is in ethnic group or race, and also if the mucosa intact with no lesion or discoloration. So we're going to inspect for the tongue. So ma'am, kindly show your tongue. Sige po ma'am. Ganyan po. Okay po ma'am. Okay na po ma'am. So as we can see, the patient tongue is pink and moist, so it is normal since it is pink and also it is moist. After that, we have done for the inspection of the tongue. We're going to now assess for the tongue the strength of the tongue of the patient. So we're going to ask the patient to protrude her tongue, and then we're going to have the patient move the tongue into the side and also side. If the patient can protrude the tongue medially and there is no atrophy, tumors, and also lesions, and it is not asymmetrical, or it is not there is no absence of movement from the midline, so we're going to protrude the tongue protrude the trunk, it will indicates for the cranial nerve number 12 damage. So it will result to the dysarthria when the tongue is being prolapsed. So, ma'am, kindly show your tongue and then ano mo siya sa gilid, tapos sa gilid. Kung makaya mo, ma'am. Sige po, ma'am. Sa tiyak na. Sa kabila na. Ganyan po, ma'am. Okay. So, after that, we're going to check for the, since the client has moved the tongue from side to side, it is normal since she applied what we have instructed in the client. So after that, we're going to check for the client's taste sensation. So we're going to have the client identify the correct flavor of the correct flavor, and then if the client has inability to do, so we're going to suggest an impairment of the cranial nerve number 7. So we're going to, so ma'am, kindly simple sa smell, pero ito po, i-taste niyo po siya. Pero i-close po yung eyes niyo and then i-identify niyo po if salty po siya, if sweet po siya, or ano po siya klase na flavor ang inilagay po sa tongue po. Sige po ma'am, kindly close your eyes and open your, and ipalabas po. So ito po ma'am. Ito po ma'am. Ito po ma'am.
Salty.
Okay po. Ito naman po ma'am.
Sweet.
Okay. Thank you po ma'am. So, since the client, open your eyes na po ma'am. Since the client has identified it, so it is normal. So after that, we are now on the neck. So first thing in the neck, we're going to inspect for the appearance of the neck. So we're going to test for the range of motion of the neck rather. So in inspecting for the neck, it should be inspect in the neutral position, hyperextended, and when the client will swallow the water, it should be erect, it should be midline, and there is no lumps, bulge, or any muscles. So, ma'am, kindly, ano na po, ma'am, check ko lang po yung, sige, ma'am, i-hyper, pataas, ma'am, ganyan, ma'am. Okay po, ma'am. Sige, ma'am, balik naman po. Sige, ma'am, inom po kayo ng tubig, ma'am. Kasi check ko lang po yun. Okay. So, as we can see, the patient is the patient's neck is erect. It is in the midline, and there is no lumps, any muscles, and also any bulges on the patient's neck. So after that, we're going to palpate for the preauricular, for the post-auricular, for the preauricular, for the post-auricular, for the tonsillar, the submandibular, and also for the submental nodes. So, we're going to lightly palpate it. So, it should be, so for the preauricular node, it is in the front of the ears, in this part. And for the post-auricular node, it is in the back of the, behind the ears, so this part. And for the tonsillar, it is in the angle of the jaw, in this part. And for the submandibular, it is lightly palpate in the mandible, so in this part. And for the submental, it is in the tip of the chin. So, it is, the lymph nodes are normally not palpable, and it is not tender. So, ma'am, sabihin niyo lang po if masakit po or hindi ang ano po natin. So, first that we're going to do is we're going to the preauricular. So, ito po, ma'am. Masakit po ba, ma'am?
Hindi.
Ito po, ma'am.
Hindi.
Ito po, ma'am. Dito po, ma'am. Masakit po ba, ma'am?
Hindi.
Ito po, ma'am.
Hindi.
Dito po ma'am, masakit po ba ma'am?
Hindi.
Ito ma'am.
Hindi.
Ito po ma'am, masakit po ba ma'am?
Hindi.
Sige pa ma'am, masakit po ba ma'am?
Hindi.
Ito po ma'am, masakit po ba ma'am?
Hindi.
Okay po ma'am. Since the client says that it is not tender, so it is normal since it's not tender and also it is not pababot. So after that, we're going to palpate for the trachea. We're going to place the thumb on the trachea in the suprasternal notch, and then we're going to move it laterally on the left and also in the right spaces bordered by the clavicle. And then the anterior aspect of the sternocleidomastoid muscle and also the trachea. So, if there is some deviation, it will be, there is possible that the patient have a tumor, the enlargement of the thyroid, and also the enlargement of the lymph nodes. So, we're going to palpate for the trachea. So, ito po. Masakit po ba, ma'am?
Hindi.
Ito po, ma'am.
Hindi.
So, as we can see, as we palpate for the trachea, it doesn't have any tumors or enlargement of the lymph nodes or also enlargement of the thyroid. So, it is normal. So, if there is any enlargement of the thyroid gland, we're going to auscultate it for the roots. So, for the normal, there is no roots, and if it is abnormal, there is a root. So, we're going to check. So, we're going to warm it. Check lang po natin, mama. So, as I can see, as I have auscultate it, there is the trachea of the patient or the thyroid gland of the patient is normal since it is not there is an absence of the tooth. We're going to palpate and also auscultate for the carotid arteries. So for the carotid arteries, it should be regular in rate and in rhythm, so it should be strong, and we're going to score it +2, and it should be bilateral in both, and it also be symmetrical. So for the if we auscultate the carotid arteries, there is no blowing and also the swishing of the other sound that is heard. So we're going to palpate it first. So, ma'am, ipalpate ko lang po yung carotid arteries niyo po. Masakit po ba, ma'am?
Hindi.
Okay, as we can see in the carotid arteries, it is +2 since it is the rate and also the rhythm is regular. And then we're going to the other side. Masakit po ba, ma'am?
Hindi.
Okay, I will score it also +2. So, since it is bilateral and it is symmetrical. So, we're going to next auscultate it. So, ma'am, auscultate lang po natin, ma'am. Kabila na. I can see that I can, while I have auscultated, I have noticed that there is no blowing and also the swishing that on of the sound. So now we are on the arms, the heads, and also on the fingers. So we're going to inspect for the upper extremities. And then, so ma'am, may I see your sleeves, ma'am? Okay, ma'am. Sa kabila naman po, ma'am. Okay po, ma'am. And then we're going to test for the shoulder shrugging and also the ability to turn the head against the resistance. So normally, the movement should be symmetrical with the patients moving against the resistance with the pain. And normally it is scored as plus 5/5. If the strength is both, it is if it is both trapezius and it is not normal if it is asymmetrical, diminished, or any absent of the movements of the movement, and if it is pain and bilateral weakness, it is indicates for the damage. So mama, gagawin ko mo ngayon, ano mo lang po, magamit yung resistance nyo, ganyan po, habang push ko siya para yan. So okay po ma'am. Sige po. Okay. So, it is normal since the patient have normally move against the resistance. So now we are going to assess for the epitrochlear lymph node so the epitrochlear lymph node, so it should be non-palpable and it also non-tender. So ma'am, ipa-update ko lang po yung epitrochlear lymph nodes, ma'am. So sige, ganyan na po ma'am. Okay. Masakit po ba ma'am?
Hindi.
Ganyan po ma'am, masakit po ba?
Hindi.
Okay ma'am, sa isang side naman po tayo. Ito ma'am, masakit po ba ma'am?
Hindi.
Ito ma'am.
Hindi.
Ito ma'am.
Hindi.
So, as I have assessed it, it is non-tender and also it is not palpable. So after that, we're going to palpate for the brachial pulse. So the brachial pulse should be scored as plus 2 in the both if it is equal strength in bilaterally. So first, assess po natin yung dito. Masakit po ba ma'am?
Hindi.
So, I have noticed that this is strong. The sound is strong, and I have scored as normal, which is the plus 2. And for the other side naman po, ma'am. So, it also strong and it also plus 2. So, the brachial pulse of our patient is bilateral and it also equal in strength. So, after that, we're going to test for the range of the motion of the elbows. So, for the test of the range of motion of the elbows, we're going to have the patient flex the arm. We also have the patient extend the arm. We also have the patient supinate. And also, we're going to have the patient supinate, and also we're going to have the patient supinate, and we're going to have the patient pronate. So we're going to have the patient flex, flex. We also have the patient extend, supinate, and pronate. So ma'am, can you please extend your arms, ma'am? And then flex your arms, ma'am, rather. Tapos i-extend nyo po. Tapos supinate po, ma'am. Tapos pronate. Okay po. So as you can see, the patient have totally follow the instructions, which is in the elbow. So it is normal since it is in the full range of the motion. So after that, we're going to palpate for the ulnar and also the radial pulse. For the radial pulse, it is bilaterally strong and it is for as positive plus 2, and the artery walls will have a resilient quality of the quality or the bounce, and for the ulnar, it is not detected. So first, we're going to assess for the radial. So, assess ko po muna yung radial pulse ni ma'am. So, I can see that the radial pulse of our patient is strong on the other side, and we're going to assess it to the other side again. So it is strong also, and it is bilaterally the both of the radial pulse is strong, which is I score +2 and also +2 to the other side. Now we are going to assess for the ulnar, which is not being detected. So I could not detect it with the other part of the body. So after that they have done, we're going to inspect also for the fingertips for the nail clubbing, or by performing the Kumra test. So, the nail clubbing should be, will indicates for the poor perfusion. So, ma'am, perform po tayo ng nail clubbing, ganyan lang po. Sige po. Hindi po, ganyan. I-tikit. So, as I can see, there is a diamond space, which is detects that there is no nail clubbing on the patient's nails. So, it is normal. After that, we're going to palpate for the capillary, we're going to palpate and assess for the capillary refill time. So, for the capillary bed refill, we're going, so it should be, if we're going to pinch it, it should be back to the normal color and in 2 seconds or less than 2 seconds. So, yeah. Okay, the other side. So, as we can see, it is normal since it returns to the color that for the normal color. So after that, we're going to test for the range of motion on the wrist. So we're going to test for the range of motion by having the patient flex it, or we're going to bend the wrist down. We're going to also extend or straighten the wrist, hyperextend, which bends the wrist back, and also perform the ulnar and also the radial deviation. So, the range of motion of the wrist should be full of the range of motion. So, ma'am, hindi ganyan po, ma'am. Tapos, ganyan po tayo, ma'am. Ganyan, ma'am. Hindi, ma'am. Ganyan. Yung wrist niyo po ang ikot. Kung kaya niyo po. Ito po, yung wrist. Yeah. Ganyan. Okay. Tapos, balik sa center. Tapos, ganyan. Tapos, ma'am, ganyan. Tapos, ganyan. Kaya niyo po. Okay. So, as you can see, it is normal since the patient have done the instruction of the nurse, and it is the wrist is full on the range of the motion. So after that, we're going to test for the fingers. In testing the fingers, we're going to test for the range of motion by having the patient's abduct, or the spread of the fingers, adduct, which is the fingers together. We also have extend, which we're going to open the fist, hyperextend, which bends the fist back. So, ma'am, can you use so we can do it performing so that the client can perform it also. So, first, ma'am, ganyan tayo, ma'am. Abduct, and then we're going to adduct. Close lang, ma'am. Tapos, i-fist, ganyan. Ganyan. Tapos, ganyan. So, as you can see, it is normal since the the range of the motion is it is with the full of the range of the motion. So after that, we're going to test for the rapid alternating of the movements of the heads. So in this, we're going to normally the upper extremities of the movements are coordinated and able to pronate and supinate for the arms upward. So ganito lang gawin natin. So yung fast mo na magawa at saka pinaka-slow. So pinaka-fast ma'am. Pinaka-fast ka ma'am. Sa pinaka-mahina ma'am. Okay. Thank you po ma'am. So as you can see, the patient has performed it and the movements are coordinated. And then we're going to test for the sensation of the arms, the hands, and also the fingers, and utilizing the whips of the cotton balls for the light touch. So we're going to normally the patient can distinguish the arms that are simulated using for the light touch sensation. So same lang po dati ay kanina ma'am, using the light touch sa face mo, pero ngayon ita-touch ko sa dito sa hands mo, sa ano mo. Tapos, pag-close ka ng eyes mo, ma'am. Tapos, ito po yung ma-feel. Say now lang po, ma'am, ha? Okay po, ma'am?
Now.
Okay. Thank you po, ma'am. So, now we are going to have the sensation, which is the paper clip, which is the sharp or dull sensation. So, ma'am, same lang po kanina, ma'am. Ito po yung ma-feel nyo. Pag sabi lang po ng now, pag-close lang po yung eyes nyo. Ito po, ma'am.
Now.
Okay. So, as we can see that the patient distinguished the dullness or also the sharpness of the paper clip. So, after that, so we are done for the first part of our comprehensive physical assessment.